Hi, my name is Justin. I'm going to perform a abdominal exam and finish the musculoskeletal exam from a previous video. This is my friend Liz. We had started our exam by washing our hands. And then you want to just do a general assessment, looking at their overall state of well-being and look at their abdomen to see if you see any gross abnormalities. I do not see any at this time. Next, we're going to move to the abdominal examination, and we start by auscultating the abdomen. And we want to use the diaphragm of the stethoscope starting at the right lower quadrant of the abdomen. And you want to look. You want to look, listen. Okay. And you're checking for bowel sounds, if they're hyperactive, hypoactive, or absent, and her bowel sounds are all within normal limits. And then from the diaphragm, now you want to move to the bell of the stethoscope, and you want to auscultate with the bell of the stethoscope. And you want to start at the right of the umbilicus. We're going to move above the umbilicus, listen to the right renal artery, left renal artery, and the aorta. And while you're auscultating, you want to listen to see if you hear any bruits, which is an abnormal blood flow through a stenotic vessel, and she has no bruits. Next, you want to move from auscultation to palpation, and you want to start by palpating the right lower quadrant, and you want to do light palpation, and you kind of move up, move around, noting any abnormalities, herniations, or masses. And then from with the now you want to move to percussion. Oh, and before you move to percussion, you want to palpate the liver, and you have the patient take in a deep breath. The liver is over here on the right side, and then you move over to the left side and you have them take in a deep breath and let it out, and you want to palpate the spleen. Okay, and no splenomegaly was noted upon exam. Now you want to move to percussion. You start in the right lower quadrant, listening as you tap, and you're listening for the sounds of a tympanic sound, which is air or fluid-filled cavity, and then the dull sound is when you're over an organ. Unless the bladder is distended, full of urine, then you will hear a dull sound. Next, you want to palpate the femoral artery and nodes, but we're just going to state that, and that's all we're supposed to do, is just state that. Next, we're going to move to the musculoskeletal part of the exam that we didn't finish. You want to palpate the hips for alignment, make sure they're aligned and they feel okay. And then we're going to check for abduction and adduction of the hip, checking for clicking or dysplasia. And we will check that by rotating their hip in and out. And I don't feel any clicking or any abnormalities. And this concludes our exam. Do you have any questions?
No.
And we will finish our exam by washing our hands, and this is the end of our video. Thank you.